this is the CT, and this is the MR. I don't know if I have more images on it. Yes, and some bad MRCP images, not that great, but. So this was called.
Rajesh is saying sarcoid. David Fetzer is also saying, do they have a chest CT? Maybe it's sarcoid. It looks like both liver and spleen are affected with multiple lesions. So it could be like sarcoid, TB, PCP.
Yeah, so sarcoid, they have like multiple lesions in the liver, multiple granulomas in the spleen, and we also caught a bone lesion. So in a young patient, if they have these multiple small lesions in both liver and spleen, obviously sarcoid becomes the topmost differential. But surprisingly, like the bone lesion was picked up on a second follow-up MRI, and he actually presented with abnormal LFTs. He didn't have any symptoms of sarcoid, so a CT chest was not performed. Since he came in with elevated LFTs, we directly started with MR, and this was first called as PHC because of this like little interruptions along the biliary tract. So the teaching point here was like even like if there's the diffuse infiltrative liver disease that can cause this beaded appearance of the biliary tract. So we should not jump onto the diagnosis of PHC as soon as we see this irregular, irregularity along the biliary tract. So, and then, yeah, this was sarcoid, and then later on, they did a CT chest on him, and he had lymph nodes and some calcification, but he was never like worked up for pulmonary sarcoid to begin with.
David is saying biliary obstruction sarcoid can cause biliary obstruction and can often get misdiagnosed as PSC or PBC.
Yes, and PHC, we have to remember that we can call it on imaging and they will not do a biopsy to confirm it. So we have to be really careful and be 100% sure on imaging before we call something as PSC on MRCP.
Cool. And apparently David wrote a paper on it, because he said there is a handsome radiologist who wrote a paper on hepatic sarcoid, ...
Oh, okay, nice.
I gotta go check it out.